Hey, I'm Eric with CPR Now, and today we're going to be going through the American Heart Association process for the BLS Provider and Heart Saver in case we come across a person who is unconscious. So anytime I see the mannequins laid out, it's actually a reminder to me that back in 2011, I had gotten really sick with multiple sclerosis, had sold all my CPR stuff, and quit my job as an occupational therapist because I had gotten so sick. But I actually went to a church. They laid hands on me to be healed in Jesus' name. And actually right now I'm several years off medication. Doctor saying, "What are you doing?" And really I can trace it all back to that touch and that moment that I had with the Lord. So really glad to be doing this for you today and going over this information. So no matter what the age of the person is, if you come across and it appears that it could be an emergency situation, you're going to walk through your 3 C's, which is check, call, care. Okay, and there's actually 2 parts to the check. So the first thing you need to check for is to make sure that the scene is safe. So if there's a fire or if there's been a car accident, you would need to make sure before you enter into that to help the person that the scene is safe so that you're safe and that that person is safe. The next part of your check is to see, are they actually unconscious? So we need to check and tap the person. Are you okay? Are you okay? If they don't wake up and respond, we go to the second C, which is call. So you're going to tell somebody, if there's anybody around, call 911 and get the AED, which stands for Automated External Defibrillator. If you're by yourself, then you would just get your cell phone out and call 911 to get them on their way. So the national average length of time for an ambulance to show up is 11 minutes. So you wouldn't want to have started CPR and then remember to call 911. We want to make sure to do that as soon as we notice that the person is unconscious. So the next C, which is care, we now need to see, do they have a heart rate and are they breathing to determine if we're going to do CPR or not. So we're going to do a 10-second pulse check. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000, 7 1000, 8 1000, 9 1000, 10 1000. If we feel that they do not have a pulse, would indicate to us that their heart is not pumping. So now we manually will need to pump their heart for them. And the nice thing that American Heart Association has done over the years is they've simplified the process. So if you're doing one person's CPR, whether it's for an adult, a child, or an infant, the ratio remains the same of 30 compressions to 2 breaths. Now, when you would go to do your breaths, to protect yourself from any bloodborne pathogens or any health things that the person may have, you want to make sure that you would cover their mouth and nose with a mask. Tilt the head back, and when you do your 2 breaths, you should see their chest rise. Another option you would have if you don't have a professional rescuer mask is they do have like a keychain mask that's smaller and you'll always have with you. And this is something where you can open this up. There's a one-way valve in there that would go over the person's mouth. And with this one, you would need to pinch their nostrils and open the airway when you had that on there, and you would form a seal with your mouth over their mouth. So we're going to go ahead and demonstrate what to do if you found that they do not have a pulse and they are not breathing. So you're going to interlace your fingers. It doesn't matter if your right hand or your left hand's on the bottom. It's what's most comfortable. You're going to place your hands on the center of the chest, avoiding the xiphoid process, which is at the bottom of the sternum. Also, even though the heart is slightly off-centered on the person's chest, you're not going to compress directly over top of the heart. You're actually compressing on the sternum, and that's what's going to most effectively compress the person's heart. So in doing a few cycles of CPR. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. So after you had done 2 minutes of CPR, which would be approximately 5 times of 30 compressions to 2 breaths, you would want to call for a switch. So if there's anybody else around, they can now do CPR and give you some time to catch your breath and to replenish your energy. And every 2 minutes, you would want to continue switching out. If you're by yourself, you would just continue doing CPR. So at 2 minutes, you don't stop, you don't check for a pulse, you would just keep going. And if you got to the point where you started feeling lightheaded or that you may pass out, it is okay to temporarily stop, catch your breath, and then start back into it. Okay, so you don't want to be like the lady one time I said, it's been 2 minutes, what should you do? And she said, do we call it? So obviously we can't call it, so you would want to continue going. I think you have to be a doctor or some type of medical professional to call it quits on a person. So just continue going. Now, let's say if you went to do your 2 breaths into the person and the chest did not rise. So you should have kind of a light bulb that would go off saying, okay, I recognize or I realize what's going on with this person. So if you try to do your breaths into the person and the chest does not rise, that would indicate to us that that person had gone unconscious from choking, or that they had some type of foreign body blocking their airway, because when you're trying to do your breath through, it's getting stuck here and it's not causing their chest to rise or filling up their lungs. So the question is, what does the American Heart Association recommend that you do for a person who has passed out from choking? And exactly the way that they put it is that you're going to begin doing CPR. So you'll be doing your 30 compressions at the same exact pace, same exact placement, and same exact depth. Now, usually the primary function of our compressions is to pump the person's heart. But in this situation where they're unconscious from choking, what do you think is the primary function of our compressions? Okay, so it's actually to try to dislodge that item, because every time you pump down, it's forcing air up that person's trachea to try to dislodge that item. So there is one added step to your CPR, or one modification, and that is after you've done the 30 compressions to try to dislodge that item, you are going to look in the person's mouth to see, did that item come up? If you don't see it, you do still try to do your 2 breaths, because that's trying to dislodge that item by pushing air down, plus your compressions are pushing air up. Then you would go back into your compressions. Now, if you look in the mouth and you do see the item, you're going to take your finger, you would sweep the item out of their mouth, do your 2 breaths, and then let me ask you, if we cleared the airway, what should we notice has actually happened with that person? And the answer would be that their chest would rise. Okay, so we're going to say you've walked into a restaurant, you see there's a person unconscious, you're like, what's going on? They said this person was choking, we had done the abdominal thrusts, but they passed out, we've called 911, and now we're not sure what to do. Now, don't be like one lady I asked one time, so what would you do? And she said, go to a different restaurant. So that's not right, don't do that. So what you would actually want to do, even if we were the new person on the scene, I'd hope each of us would feel confident to know this person needs to have CPR to dislodge that item. So you could actually immediately go up to that person, beginning with your 30 compressions to dislodge the item. 15, 16, 17, 18, 19, 20, 21, 22, 23, 25, 26, 27, 28, 29, 30. Okay, you look in their mouth. I don't see it, so I'm going to still do 2 breaths. Okay, right back into the compressions. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. Okay, so you look in the mouth. This time I see it, so I just pretend I'm going to sweep the item out. Do the 2 breaths. Okay, and then how would I know that I've actually cleared the person's airway? Okay, so the correct answer, you should see their chest rise because now your breath is going through their trachea into their lungs, causing it to expand. So at this point, depending on how long they've been unconscious, now we need to do another 10-second pulse check to see, they may still have a pulse or they may not. So to do that, we're going to do 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000, 7 1000, 8 1000, 9 1000, 10 1000. So if we find that they do have a pulse, so their heart is pumping, and they are breathing, but they're still unconscious, we would not want to leave the person lying flat on their back, because if they were to throw up, they could actually choke on it and aspirate on it. So what we'd want to do with that person, so they're unconscious, they do have a pulse, and they are breathing, is you would raise one arm up, bend the opposite knee up, and then you would actually roll that person onto their side in the recovery position, continuing to feel for a pulse. And this way, if they threw up, their head and neck is in a gravity-assisted position to where it would go out of their mouth instead of back down where they could choke on it. Okay, so that's those skills with the adult. Now we're going to walk through the same check, call, care, but this time for an infant. So the steps are the same, but some of the techniques are a little bit different. Okay, so I'm going to test your memory. We're going to go through the 3 C's. So what's the first thing that we need to check the scene for? Okay, so we need to check the scene for safety. We see an infant that we could appear to be unconscious. We're not sure. So instead of tapping on their shoulder, you're actually going to tap on the bottom of their foot, because a baby has a reflex there called the Babinski reflex. And if they're conscious, they should draw their knee up and coo, and that would indicate to us that they are conscious. Now, if they don't wake up, they don't respond, we do the second C, which is call. So we're going to tell somebody, call 911 and get the AED. So remember, we're telling them 2 things. Okay, then always with 2 fingers, never with your thumb. On the infant, you're going to check on the brachial artery to see if they have a pulse, and we're watching to see if the chest is rising. 1 1000, 2 1000, 3 1000, 4 1000. 5 1000, 6 1000, 7 1000, 8 1000, 9 1000, 10 1000. So if they do not have a pulse and if they are not breathing, so obviously we're going to start into doing CPR for the infant. Now with the infant, they give you 3 different techniques that you can choose from to do your compressions. So you can either use your 2 fingers directly between the middle of the nipple line, pressing down 1.5 inches at that same pace that you were at with the adults. So you can do that technique. You can also do the 2 thumbs and circling hands technique and do your compressions that way. And the third option is that you can use just the palm of your hand directly between the middle of the nipple line. Okay. Then with the infant, because their mouth and nose are so small and close together, you could use the adult mask, but you would just want to turn it upside down. You press down to make sure that it forms a seal around their mouth. And when you do your breaths, you're actually going to do 2 puffs. Okay. So going through just a couple cycles of that CPR, switching up some of the compression techniques. So I'm going to begin with the hand compression technique. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay. Again, so after 2 minutes of CPR, you would switch out with somebody else. And if you're by yourself, you would just keep going. Now, again, what we had mentioned with the adult, if you went to do your 2 breaths into them and the chest did not rise, that would indicate to us that the infant is unconscious from choking. So we're going to do CPR on them. Again, the compressions primarily to try to dislodge the item. And the one modification that you make with the infant is instead of using your finger to sweep the item out, you would use your pinky. Okay, so these are the procedures that you would go through in an emergency situation. So if you have any questions, we'll go ahead and talk about that. And thanks for following along with us for this process today.